consultant and cardiology.
Yes, just introduce yourself again, Dr. Tariq.
Okay, Dr. Dua. I'm Dr. Tariq Osman, or Dr. Tariq Khairi, cardiology consultant and cardiology lecturer in Shams University. And I'm working right now in Saudi Arabia, in Saudi German hospital in Saudi Arabia.
Congratulations, Dr. Tariq. ألف مبروك.
Many thanks, Dr. Dua. Really, this success mainly by you. And I'm not saying that because I'm talking to you now, but many thanks to you, Dr. Dua. You are always here, like Dr. Dalia said. Anytime I send you on WhatsApp, you reply on me, and you helped us a lot in gaining a lot of information about many diseases. And my only source for my paces is your notes, in addition to the notes of Dr. Meher in the examination, in the advanced and mock exam course. So my only source really for studying these paces is your notes. I wrote everything with you during the session and after the session. From the recorded session, I wrote everything regarding the communication, regarding the LCC cases, diagnosis, differential diagnosis, investigation for different diseases, the management plan for the different diseases. Because Dr. Dua, I entered step 1 in May 2019, and then I entered step 2 in October 2019. And it was supposed to enter these spaces in 2020. And then Corona came, blocked everything. And I tried to enter in 2022. In 2021 first, there was a lot of waiting list. Then I tried in 2022 in Egypt and in Agman and Sharqa, I think, or Dubai and Sharqa, something like that. And also it did not come to me. Again, I tried in Egypt in 2023, and also I was in the waiting list, and the rotatory did not come to me. And then I did not try again. To be honest, in 2024 and 2025, I did not try to enter the exam. Then I tried to enter in February 2026, and alhamdulillah, it came to me, the rotatory. So it was a long time, maybe 6 years difference between the pieces and step 1 and step 2. So almost I was entering the course with you maybe in last February, something like that, 3 months before the exam. And this is the start of my studying. I studied only for 3 months. And the first month was mainly warm up to know what is the paces, what is what to be what is the main target from this course, what is the target from the exam. It's not all about knowledge, because I don't have a lot of knowledge, by the way, but as Dr. Dalia said, we have to be organized, and we have to know what's the target from this exam, is to know how to examine a patient, how to bring the diagnosis or even differential diagnosis, how to choose the best investigation for this case, and how to manage the patient or treat the patient. Just points.
Yes.
From my experience, the most important things is to be confident, organized, and when you finish a session in the exam, you have to forget about it. Because, by the way, I was very sad after the neurology case, because I forgot to make the gate. For example, okay, it was cardiology and neurology. Cardiology, I did it well, alhamdulillah, the examination, and answered all the questions. Regarding the neurology case, I did it well also, but I forgot to make the gate. And the examiner asked me, did you do the gate? I told him, no, I forgot to do it, but I have to do it because this patient had a stroke, had the upper motor neuron lesion, unilateral, so it's supposed to be circumduction gate. And the examiner was very, very tough and was very mask-faced examiner. And then I found after that I got 20/20 in the neurology case. So this means that after any session in the exam, we have to forget about it.
Yes.
This is very important. What else regarding the? This is regarding my my studying period, around 3 months. My source is the notes from Dr. Dua. Write everything from the course of the LCC and the communication. And even if you did not find any time to write all the notes during the session, you can write it later from the recorded session. Regarding the communication, I was very, very bad in the communication during the course, I know. But what I did, that I made all the communication, all the sessions of the communication, I heard it several times, even in my car. while going to my work, while coming back from the work, while going to bring my daughter from from swimming pool. I heard these communication sessions several times. And also, I wrote all these communication sessions in the form of question and answer. Then I read it several times also. This what helped me in the communication. This is regarding the communication. Regarding what? Regarding the last days, last 2 weeks before the exam, I was in Saudi Arabia. Then I came back to Egypt for the exam, maybe 11 days before the exam. So these last 11 days, I attended the mock exam with Dr. Ahmed Maher. I was concise to know how to examine the patient, how to say the positive finding only, because it is very important to say the positive finding only in the case, to know the most important differential diagnosis, investigation, and the treatment plan, which should be non-pharmacological and pharmacological. Then number two, I heard almost all the communication sessions again. I heard them maybe 2 times, and I read all the notes that I wrote before regarding these communication skills, the question and answers. Number three, I revised all the NCC cases. Maybe I think it was 120 or 170 cases, something like that, we took in the course. NCC cases, I revised all of them with some of them with Dr. Islam, but the rest of them with Dr. Amr Khalid. We revised all these cases maybe in 3 days, every day around 6 hours or 7 hours. We revised all these cases. We just revise by telling each other the positive data in the history and the positive data in the examination. Then we will discuss about the diagnosis, differential diagnosis, investigation, treatment, and what to examine in such patient.
Yes.
This helped us a lot.
Yes, very good. So what about the LCC, Dr. Tariq? LCC is like math. Yes, I think you all recognize that it is to solve a case of LCC, it's like a math that you need to understand in order to reach in the real exam. Yes?
Yes, this is true. This is completely true. Regarding the LCC cases, for example, in my exam, I have 2 LCC cases. The first one was patient from the start, from outside. They told us patient, 18-year-old female patient, had bleeding per gum. Very, very important during the preparation in the 5 minutes before entering the exam is to write all what I will ask about this complaint and all the main points that I will ask in the history. This is very important because inside the exam maybe something will be missed, and maybe this thing will be the clue for the diagnosis of the case. For example, if I did not ask this patient about the joint pain, which is one of the 10 Ds of the 10 questions, the routine question that should be asked, if I forgot this, I will miss that this patient had a systemic lupus. So we have to write all the points that we have to ask about in the history, and to be organized, as Dr. Dalia said. Very important to write notes during asking the surrogate inside the exam. Write notes, write the positive data only. He told me that she had joint pain, so I have to write joint pain, and then I have to ask about this joint pain. Every complaint for the patient, I have to analyze it. So when I asked him about this joint pain, he told me that it's more. I told him about the stiffness. He told me I'm not sure. Then I told him, is it more in the morning or in the evening? He told me more in the morning. So he guided me that it's mostly a morning stiffness.
Yes.
And he gave me a positive family history for her mother for autoimmune hepatic disease. So there is a positive family history of autoimmune diseases. So this case was the clue in the diagnosis was the morning stiffness for the joint pain, small joint pain or hand joint pain. So my diagnosis for this case was lupus, systemic lupus, with lupus nephritis, because by taking a history, he told me that there is a decrease in the water work. So this means that there is an acute kidney injury. So I told them that this is mostly a systemic lupus with lupus nephritis. Also, by asking about the drug history, he told me that she is taking for a few weeks non-steroidal. And when I asked him about the doses, he told me maybe 3 to 4 tablets per day for a few weeks. So this decreased water work may be acute interstitial nephritis, drug-induced. And when he asked me why in a patient with lupus and lupus nephritis had a bleeding tendency or bleeding gum, I told him maybe thrombocytopenia from the lupus flare or lupus activity, and also I told him it may be hemolytic uremic syndrome. This may cause renal impairment or acute kidney injury with hemolysis and bleeding. Also, he asked me if this patient had fever and the neurological manifestation, what will be your differential? I told him thrombotic thrombocytopenic purpura. So this is the first LCC case. Other thing, in this case, there was oral ulcer. I asked if there is any oral soreness. He told me, or mouth soreness. He told me, yes, there is mouth soreness. I asked him, it's painless or painful. He told me, I'm not sure. But this oral ulcer with the joint pain, go with systemic lupus. This is the first LCC case. Second LCC case was the second LCC case. It was hepatosplenomegaly. Hepatosplenomegaly in a patient with in a farmer patient, okay, with a positive history of bilharziasis. He had a bilharziasis 20 years ago. So my first differential was bilharzial hepatosplenomegaly, and then I told them also it may be brucellosis, and then I told him also it may be also viral hepatitis B or C, causing hepatomegaly complicated by portal hypertension and then splenomegaly. And I put the hemolytic anemia in the last differential. So the main differential was bilharziasis, brucellosis, viral hepatitis. The patient was a little bit overweight, around 100 kilograms. So I told him also I have to put muscle or اللي هو الناش or non-alcoholic hepatosteatosis. Also, I put it in the differential diagnosis and autoimmune hepatic disease.
Okay.
In this session, he asked me about the investigation. I told him build a ultrasound, and then we have to make also for the bilharziasis rectal snap. I told him about the stool analysis, pelvic abdominal ultrasound. I told upper GI endoscopy because he told me, yes, after I remembered. He told me that in this case, it was written that the patient had melena. This was the clue in this case. So he was impressed when I told him that I have to do upper GI endoscopy for this patient because maybe esophageal varices causing this melena, and we have to do ligation for this esophageal varices. And I completed the investigation, the virology, the investigation for the autoimmune hepatitis, primary biliary cirrhosis, autoimmune hepatitis, and sclerosing cholangitis. All this was in the differential, so I put investigation for each of them. And regarding the management, the most important was the ABC because this patient had hematemesis. So he may be shocked, he may be, he was vitally stable, but I mean that he wants to know that any patient with hematemesis or melena should do ABC first and proceed back to the management of the cause.
Okay.
This is the second.
Yes.
This is the second LCC.
Second LCC. Communication.
Communication. The first one was patient diagnosed with pulmonary embolism a few weeks ago after a long journey. And he came to the clinic and he's not compliant on his anticoagulant or the blood thinner medication. So my rule is to know why he is not he's not compliant on his medication and to advise him about this medication and see if any other concerns appear during the discussion. So first of all, I asked him if he knew about this pulmonary embolism, what is the cause or what's meant by pulmonary embolism. He told me, no, I don't know a lot. So I discussed with him. We took a scenario like this before in the course, but the patient was at that time was pregnant, I think.
Pregnant. Yes.
Yes, and had DVT pulmonary embolism. So I told him, I explained to him, and I make a drawing like Dr. Da told us in the session. We have to draw everything, draw the lung, draw the heart, the pulmonary artery coming from the heart. And then I showed him that this embolism blocking the pulmonary artery may be coming from clots in his leg due to the long recompense in his long recent travel. Then I asked him when he told me that I don't want to take the medicine and I'm not compliant on him. So the first question to ask him why, as Dr. Da told us, why he is not compliant on the medication to solve his problem. He told me that he is afraid that this blood thinner may cause bleeding for him. So I asked him if already bleeding occurred. He told me no. So I told him, as any medication, it has a risk-benefit ratio, but in your case, that the benefit outweighed the risk. So you have to take the medication. Then he asked me about the duration. I told him maybe in your case it may be from 3 to 6 months only, because this DVT is provoked by the prolonged recumbency, but we cannot say that except after doing all the blood tests to make sure that you have not a familial disorder causing increased blood viscosity, so you'll be predisposed for pulmonary embolism later.
Yes.
Then he asked, mostly this scenario is very short, by the way. This scenario, I finished it more than 1 minute before the end. Yeah, I finished the scenario and I asked him several times, any concern, any concern? He told me no, and then we waited for 1 minute till the session ended. So the short scenario. The other one was a long scenario, was long. The other communication session was long. It was about a patient had latent TB, accidentally discovered latent TB while she's doing chest X-ray to take biological therapy for rheumatoid arthritis. And we took this case like this before in the course. And all the questions asked inside the exam was taken before in the course with Dr. Dua. So when برضو at first I started with explanation and the drawing for the patient, what's meant by latent TB, and why she catched this latent TB mostly for her mother, because she had a positive history that her mother had TB before. And then I told her that we have to treat this TB first, this latent TB, before taking the biological therapy. And the patient told me, how come to treat me and I am not symptomatic at all? I'm doing everything. I am working. I am taking care of my mother, my children, and I am in a good health. Why to take a medication? So I told her again that we are taking this medication because you will take biological therapy, which will cause immunocompromisation and may lead to flare for this TB. Then she asked me about her children. She had children in the same home. Maybe they have also latent TB. I told her we can do for them the screening test, the tuberculin test, and chest X-ray. But even if they have latent TB, we will not treat them because they will not take the biological therapy like her. So they are not at risk. The main issue regarding this communication case, this is my error in the exam. My mistake is the patient asked me a concern 2 times, and Dr. Dai told us several times, if the patient asked a question for the second time or for 2 times, this means that the patient wants to hear another reply. This is very, very important. Any concern will be asked to the candidate in the exam for the second time. This means that the surrogate or the examiner wants to hear another thing, wants to hear another explanation. When she asked me about the biological therapy, the management of the TB, latent TB, it will be the 2 medication for 3 months. So the patient asked me, I will wait and I will not take the biological therapy till I finish all the medication, all the course of the TB medication. I told her yes, but this is a wrong answer. The true answer, the true answer is she should wait at least for 1 minute. She should wait. She should wait for 1 month taking this medication for TB, and then after that she can start the biological therapy with the medication of the TB. So when I answered her, yes, you have to wait the 3 months till we finish the TB medication first, and then start the biological therapy. She asked me again, doctor, I have to wait for 3 months to start the biological therapy. I have a severe pain. The patient had rheumatoid arthritis. I have a severe joint pain. So at that time, even if I don't have the knowledge about the duration, I have to tell her we will make a multidisciplinary team with the joint doctor and ask him about this issue. But I did not answer like that. I told her, yes, I'm sure you have to wait for 3 months. So this is my mistake in this case.
Yeah.
بس يعني it was an easy also case and we took
But you got
like
a marvelous mark, Dr. طارق. ما شاء الله، الله أكبر يعني.
الحمد لله.
Your score يعني you got it.
الحمد لله.
Okay. Last advice for those who will prepare for PACES. يعني لخص الدنيا كده.
حاضر. Okay. Was my advice mainly to be organized, to know that the PACES exam did not want you to have a lot of knowledge. Just need to be organized, to know uh, as Dr. Da said, this is LCC case like a problem solving. You bring the positive data from the history, the positive data from the examination, and then you put diagnosis, even differential diagnosis. If you don't know a diagnosis, just a differential diagnosis, and then try to choose the most important and relevant investigation and treatment for this case. خلاص. Mostly in most of the cases يعني maybe in my exam they did not go in depth in anything regarding investigation, regarding treatment. يعني maybe the only thing that they go in depth is the infective endocarditis in the cardiology case. خلاص. He asked me about the criteria, how to diagnose, echo, culture, and also it was not too much in depth. But I mean that most of the exam he don't want to know a lot of knowledge from you, and he don't want to know anything in depth. He just want to know that you have got the idea from the exam, that you know how to manage this patient and how to choose the investigation. What is the differential diagnosis, even if you don't have a certain diagnosis. Regarding the communication, you have to hear a lot. Hear the sessions of Dr. Dua several times. Dr. Dua record all the sessions, so hear it a lot of time while going to work, while sitting in the home. Hear a lot of these communication skills and try to write it in the form of question and answers. Try to write it in a book in question and answers and then read it. This helped me a lot because يعني my يعني الحمد لله I passed the communication skills one of the two communication skills I got 16/16. But during the course يعني my level was not that good in the communication. But what helped me a lot to hear a lot the sessions or the communication from Dr. Dua and write it in the form of question and answers. That's it.
Fair enough. Congratulations, Dr. Tariq, again and again for your
Thanks
great
دكتور
success.
دعاء and many thanks to you دكتور دعاء. يعني فعلا والله حضرتك انا كنت بحس ان انت اللي يعني انت اللي داخله مش احنا. انا كنت حاسس ان انا بارد شويه
كنت دخلت اسهل.
بس الحمد لله.
الحمد لله دكتور طارق، وان شاء الله يعني ما يبقاش
Thank you
اخر
دكتور
تعامل
دعاء very
باذن الله.
much.
Thank you
ربنا
دكتور
يخليك
طارق.
ان شاء الله. ربنا يخليك. اتفضلي. مع
ان شاء
السلامه.
الله. Thank you دكتور طارق. Okay, Dr. Riham, are you here?